changing the way we think and how we live our lives is one step in the right direction. Welcome to Be Well Berkshires. I am your host, Jim Willis. Everyone has a great holiday season, and thank you for tuning into our show. We're going to get right into it today. Dominica D'Avella is our guest today. Welcome to our show, Dominica.
Thank you, Jim.
So you're a health fitness specialist. Tell us a little bit about yourself and what you do.
Sure, Jim. Well, as you said, I'm a health fitness specialist, and basically what that means is I work with both individuals and small businesses and organizations to make positive health behavior changes. So through health coaching, integrative fitness work, really taking a lifestyle approach, helping people put the building blocks in place to enhance their quality of life and well-being.
That sounds very exciting, and you're part of the Healthy Pittsfield initiative as well.
Yes.
And we've been working, Be Well Berkshires and Healthy Pittsfield have been working together for many years, and there's been some transition for where it was originally through downtown Pittsfield to under the purview of the Pittsfield Board of Health. So how are things going with Healthy Pittsfield these days?
Things are great with Healthy Pittsfield. As you mentioned, it was an initiative that started under Downtown Inc. and was responsible for creating the downtown walking loop. And about a year and a half ago, they approached the health department in Pittsfield about coming under the umbrella of the health department. So there was a little bit of switch in terms of the mission. Obviously the mission of the health department is to, maximize health and quality of life for the Pittsfield community. So we worked really hard in 2014 to make that shift, to grow the partnership in terms of the partners that are included, and to work across all of our action areas. There are 4 key action areas that Healthy Pittsfield is active in. So active living, healthy eating, mental well-being, and tobacco-free living. And right now we're working on 2015 plans. We're actually looking for folks interested in joining either the steering committee or the working committees, which get to do a lot of fun stuff in terms of engaging the public and really working to increase access to low and no cost opportunities to enhance quality of life and well-being.
All 4 of those areas that you spoke about are really important. There's the physical, environmental stuff that we need to do a better job at, is making sure that our sidewalks are walkable, accessible to all users. But tobacco use, mental well-being, looking at the county health rankings from the University of Wisconsin, which has really picked up a lot of momentum. That's really our go-to tool in assessment across the nation of looking at how our counties rank. Berkshire County is still pretty bad. We have really good public access to health care, but outside that, it's pretty poor. And looking at those 4 conditions, major chronic health disease issues, the cost of health care in this country is just way out of control. I think, those 4 areas are just really important things to talk about. Is there anything you want to go into detail about those 4 areas with Healthy Pittsfield? Because you guys are doing an awful lot in the city of Pittsfield. Absolutely.
In case people aren't familiar with the county health rankings, Berkshire County has consistently ranked in the bottom quartile of Massachusetts counties in terms of health outcomes. And that's one of the things that really drives us with the Healthy Pittsfield initiative, is that, we would like to see Berkshire County and, in particular, Pittsfield driving that, move up in those rankings. And a lot of it really comes back to the choices that we make on a daily basis. Yeah. So, Northern Berkshire Community Coalition had a meeting last Friday about healthcare in Northern Berkshire. And Dr. Mark Pettis, talked about the fact that people don't get healthier in hospitals and doctors' offices. It's our moment-to-moment choices that make a difference. So within those areas, how much we move, what we choose to eat, our mental well-being, the choices that we make about use of tobacco have a huge impact in terms of how our behavior translates into our quality of life.
Yeah, and of course, you working through the Board of Health as well, and the health department, you guys have done wonders on tobacco control. We're seeing great bike lanes, with the reconstruction of downtown Pittsfield and now Tyler Street. We're seeing clearly identified walking loops. We've talked about that previously on the show. Mm-hmm. We're seeing a lot more walkers out there. North Street when there's no snow on the sidewalk. There's a lot of people out there moving, and it's wonderful that Healthy Pittsfield and many other organizations are doing whatever it takes to be sustainable and kind of get us into that next direction. And I think you're right. Part of what you do as a career, as a health fitness specialist, I think there's a lot of people that we're at that point in our society that people need help. It gets overwhelming. We were talking about this before the show, where there's a lot of information overload. I know businesses are really moving towards offering wellness programs that are not only covered by their insurance, but the employers are offering incentives to get their employees in the right direction, because they're paying for the insurance, and it's only beneficial that they have lower premiums and better health outcomes. They need to start investing into that. So we can talk about that as well. I'm sure you're super busy when it comes to being a health fitness specialist.
Absolutely. You mentioned the workplace aspect. And one of the reasons that that's so incredibly important is that obviously the healthcare costs jump to mind, and they've increased much faster than inflation. And when you have healthier employees, they're not only less expensive in terms of healthcare costs, but in a lot of other respects as well. So workers' comp, disability, in terms of productivity losses, so presenteeism, absenteeism, it impacts businesses on a lot of different fronts. And just from, kind of the standpoint of doing the right thing, higher functioning human beings are higher functioning employees. That translates into both their work lives and their personal lives as well.
Yeah, and obviously the health outcomes is probably the most important thing, but just morale. If you're, I've been on both sides of the coin, where I've been an employee and now I'm sort of the employer. If I had a boss or an organization that really cared about me, and they cared about my mental well-being and my health and my outcomes, you're going to see that productivity increasing, and maybe you'll get some more longevity in these businesses, because it seems like everyone's just turning over staff all the time, whether you're in the municipal sector, and that's what I'm talking about. But even the private sector, the nonprofit sector, people aren't staying in positions for 40 plus years anymore and retiring from positions like we did in GE. So people are coming and going, and maybe some of that is attributable to poor work environment, and presenteeism is the new word we're looking at, where people aren't calling in sick, they're just coming to work and maybe staring into a computer all day, and they're not doing anything. And so I see, and I've had many people on the show talking about, where their place of work, they actually invest heavily into worksite programs. And I actually see people that are more healthier, they're happier, and they're even more productive, even in their personal lives as well. I think that plays an important role as well.
I think you make an excellent point, Jim, in terms of there is great data out there that shows that for a long time the focus in the workplace in terms of productivity was on employee engagement. And employee engagement is very important, but what some of the data has teased apart is that engagement is really secondary to well-being. And there have been large-scale surveys done that say the #1 predictor of employee engagement is actually whether employees perceive that their company and their boss cares about their well-being or not. So absolutely, that impacts productivity, and I think more and more employers are realizing that for the purposes of recruitment, retention, keeping high-performing employees, there needs to be an environment that sends a clear message to employees that the employer cares about their well-being.
Yeah, and on the personal side, if we're not relying on employers offering those types of programs, and the average person out there, working full-time with kids, working 60-plus hours a week, they need to lose weight. They need to get away from that sedentary lifestyle. Get into it with us and our viewers about what we can do to make better choices for ourselves, because there's a lot of information out there. I keep talking about information overload. People go to the internet, they're looking at this exercise program, they're looking at that exercise program, they're looking at that diet, they're looking at this diet. What can we do to increase for our own selves without relying on whether or not our our company offers insurance. What can we do better for ourselves to move in a different direction if we are living that type of lifestyle?
Absolutely. You know, I think you raised a great point. People spend a disproportionate amount of their waking hours in the workplace. So by virtue of that, a lot of unhealthy behaviors occur in the workplace. So that's a great place to start, whether an employer has a formal wellness program or not. You know, it's been shown that being sedentary, you know, sitting a lot, is an independent risk factor for chronic disease. So just through the course of a workday, from a movement perspective, standing up more, taking short walking breaks are things that we can do that really benefit our health. You talked about how much different information is out there, and that's absolutely true. And what we really need to do is to find a way to find the credible information and kind of leave the rest. It's kind of the idea of principles versus methods. There are a lot of different methods, but it really comes back to what are the core principles. So from a physical activity standpoint, the main principle is really simple: move more, sit less. You know, from a nutritional standpoint, incorporate more whole food, less processed food. Jamie Oliver, the Naked Chef, you know, has a great quote that he talks about the fact that real food doesn't have ingredients, real food is ingredients. So something as simple as increasing the number of servings of fresh or frozen fruits and vegetables throughout the day. A lot of times people get into trouble on the nutrition front when they're pressed for time. So how can you kind of plan ahead and, you know, have snacks ready? The psychological well-being piece gets really neglected. So stress management is a huge one. When we're really stressed out, that not only kind of wreaks havoc in our bodies from a physiological standpoint with stress hormones, but that dysregulates appetite hormones, and it can be a really negative spiral. So all of the things really work together, and a lot of times we forget about sleep. So whether we're getting enough, whether it's of, you know, a good quality, that really enables those other behaviors to be more helpful to us.
All great points, because I think it's hard now. And you know, we have people working multiple jobs to try to get by. You have working parents now. You got kids in daycare, but you know, it always seems like we forget about ourselves. We know we put our family and our friends and our kids ahead of us, and then next you know, you're in your mid 40s to 50s and you're significantly overweight. You're completely stressed out. You know, we need to make changes for ourselves, and obviously each diet plan and each exercise plan is different according to your demands and, you know, your physical level and so on and so forth. But I think there's a lot of misconceptions out there about like eating healthier. I mean, I talk to people all the time through our Well Berkshires network where, oh, it's too expensive to eat healthy and organic food is too expensive. You know, access to healthier foods, and talk a little bit about, you know, that and, you know, the misconceptions out there of, is it really true that eating healthy is more expensive? In your opinion?
I don't think that's necessarily true. I think it depends a lot on how you go about it. So I'm very much a fan of the Michael Pollan perspective on nutrition, which, you know, he kind of boiled it down to one sentence: eat real food, not too much, mostly plants. I think what gets expensive in a lot of cases are when we're buying processed, packaged food. There are a lot of ways that you can put together really healthy meals from whole food ingredients. So a whole grain, say brown rice. There are lots of other ones. Some frozen vegetables, you know, a lean protein, and you can have an infinite number of combinations. That's a pretty, you know, inexpensive and easy meal to put together. So I think part of it is perception, and I think some people who choose to eat healthy choose to devote more of their budgets to it, you know, based on what they buy, based on where they buy it, based on how they buy it. But it doesn't have to be more expensive. I think really a lot of it is about mindset and choosing to make that commitment, because like you said, if you don't take care of yourself, then you're really not in a position to be able to take care of all the other people that you care about. So self-care isn't selfish. It's really what enables you to, you know, give back to the people that you love, to your community, to whatever is important to you.
Yeah, absolutely. And, you know, one of the things that I know Healthy Pittsfield, as well as Well Berkshires and what we do, is trying to, you know, increase the accessibility to healthier food choices, whether it's the healthy dining program, You know, we're looking at corner stores now, looking at the retail environment with a new, our mass in motion funding is looking, you know, we're doing really well with our healthy dining restaurants. We have 30 plus restaurants that are really actively engaged into the healthy dining program. But really education and outreach is, I think, to the consumer. You know, I think we can't force people to choose the healthier choice when they go to a fast food restaurant. But if they open up the menu and 4 out of the 5 choices on that menu are healthy dining designated, the hope is that at some point in time, people are going to educate themselves and choose the healthier choice. But I think increasing the accessibility, and I think, you know, food deserts is another problem that I think we're having, especially in Berkshire County. I mean, you know, Pittsfield and North Adams is sort of like the urban communities, but outside of that, we're looking into more of the rural setting. And, you know, you have to drive 10 miles to the grocery store, but once you get to the grocery store, there's no healthier food choices. And so we all need to do our part in, you know, in outreach and educate to everyone to eat healthier, because you're absolutely right. If you're not taking care of yourself, you can't take care of your kids, you can't go to work, and the whole system falls apart. So wonderful work and everything that you're doing there. And I know you wanted to mention this event that's going up at BCC on January 31st.
Yes, you know, another great opportunity to engage in wellness from a community perspective. The Physical Therapist Assistant Club there, in order to promote wellness in our community, has their Wellness Day on January 31st. And it's really a great event. They donate the proceeds to a wonderful organization called Empower Spinal Cord Injury. And, you know, they would love to have all members of our community think about coming. There's going to be lots of educational information, some fitness classes, some massages that are, you know, very reasonable, some raffle prizes as well. So that's open to, you know, anyone. You can attend for free between 10 a.m. and 2 p.m. on January 31st. And if there are any businesses interested in donating raffle prizes, Michelle Darrow is the head of the Physical Therapist Assistant program there, and she would be more than happy to hear from businesses that would like to support the students' efforts to enhance wellness in our community. Great.
Now, is that information, will that be uploaded to the BCC website, or is there a specific, if someone wants to go to a specific location to get all that information? That's a lot of information to take in over the show. What's the best way for people to get a hold of? Is there like a website or an actual direct phone number?
I'm sure that BCC will have the information on their webpage. They do a great job of advertising the Wellness Day, so it's still a ways away.
Yeah.
So, you know, I think you'll be seeing more and more of that information out there, or, you know, you can just call the main college number and ask for Michelle Darrow's extension.
Yeah. It's amazing, getting back to just overall wellness, like everybody is talking about wellness now. I mean, it's amazing how quick the whole health and wellness aspect has just unloaded across the nation. You know, workforces are talking about it, public health folks are talking about it. I mean, we even have politicians talking about health and wellness now, and you know, it's really taken a hold. I mean, I think we still need to do a better job, but you know, everyone's, you know, the schools are talking about it. It's hitting every sector, because I think it's really, really important. You know, our overweight and obesity rates in Berkshire County are high. You know, they're in the mid 30%. You know, even though Massachusetts is they claim to be one of the leaner you know, states across the nation, there's still a lot of work to do on that. And getting back to the Healthy Pittsfield and the volunteers, I think that's really important as well, because trying to come up with a sustainable grassroots approach on whether it's Healthy Pittsfield or any other local initiative, that's really important. So what can we do to reach out for those watching this show and others to try to engage new volunteers and to expand on what we're currently doing?
Well, you know, with Healthy Pittsfield, the model that we follow is really educate, engage, empower. So what we're looking to do is increase awareness, give people the tools to take better care of their own health. As you pointed out, it really comes down to no one can make you healthier. That choice really has to come internally, so that you have the tools then to be more accountable for your own health. So anybody that would like to be involved, you know, there are a lot of great events that we do. Folks may have heard of the Superfood Drive that the Healthy Eating Committee sponsored last summer. The Tyler Street Walking Loop, came into being this year. There are additional walking loops to come. We're always looking for new ideas. We'll be involved in some of the Third Thursdays again. But it's really about just finding out, hearing voices from the community in terms of what's wanted, what's needed, and anybody that's interested can contact Gina Armstrong at the Health Department in Pittsfield. And there's information about Healthy Pittsfield on the city website. And folks are welcome to attend, one of the meetings, find out a little bit more, find out how they can volunteer, be healthier themselves, and help their neighbors be healthier.
Yeah, absolutely. I think volunteers that's where the rubber meets the road. I mean, we can all come up with all these initiatives and policies and regulations. When someone within their own community, if you're someone from within the Tyler Street business sector, for an example, they're the ones out there doing the walkability assessment. We just this huge walkability assessment in conjunction with the clearly designated walking loops, which they look great, by the way. And there's a lot of people using them. Every time I drive by Tyler Street, everyone's out in the streets. There's this sense of ownership. I think it's a little bit different, when you have someone from within a community rather than just paid staff, for example, out doing it. I think, people underestimate the power within themselves that they can make significant change. One voice turns into two voices turns into a coalition turns into, going in front of the city council or the mayor or even the Board of Health to ask for change in policy. And I think don't underestimate yourself if you're really interested in really volunteering on whatever committee that you want to do.
Absolutely. Healthy Pittsfield is a fully volunteer initiative. There is no paid staff, there's no formal budget. So all of the things that are happening because people care. Right. They want to improve the health of the community. Right. So, we welcome anyone who, has that same idea in mind. Yeah.
Yeah, it's really, we've done a lot of work, but I think there needs to be a lot of work being done. And, being an active member on the Board of Health, for example, there's a lot of roles and responsibilities that I think boards of health, health department staff have to take, whether you're dealing with routine inspectional services and making sure the restaurants are in compliance and making sure that there's no disease prevention. What are some of your thoughts being on the Board of Health, what you've seen over the last couple of years on, the huge amount of responsibility that we have to take from a health department perspective?
Well, I think, a lot of our community doesn't realize how different Massachusetts is than a lot of the rest of the nation because of home rule and the fact that we have boards of health in pretty much, every city in town that, have responsibilities conveyed by state law. That's a huge undertaking. So we have more boards of health in Massachusetts than the entire state of California.
We do.
And, most of them are volunteer. There's a lot that's involved in terms of all of our powers are conveyed by state law, and we have to be mindful of what we're charged with. And there are 10 major priorities of public health, so we have to try and keep all of that in mind. Right. Which spans everything from the regulatory and code enforcement aspects to the prevention and wellness aspects, and a whole lot in between.
Yeah, absolutely. I think many people from the community think the health department is strictly do your restaurant inspections, do your housing inspections, and that's pretty much it. All we need to do. There's all these unfunded mandates, from testing beaches to just reviewing the day-to-day operations. And I always like to get a different perspective from different Board of Health members, because each community is a little bit different, but we're still tasked with the same responsibility of making sure overall health and wellness in the community is protected. So, and you guys have done a tremendous amount of work in the city of Pittsfield, and there's a lot going on in the city of Pittsfield and many other communities in regard to health and wellness. So, well, we're almost wrapping up at the end of the show. It goes by pretty quick when we start talking about really interesting topics. So, any final thoughts on what you do, and any information you want to give out to the viewers at home on how to get a hold of you, Healthy Pittsfield websites or anything like that?
Well, any information about Healthy Pittsfield can be found on the city website. I want to wish everybody, a very healthy, happy holiday season and New Year. The New Year is really time for those New Year's resolutions, and I would encourage people to be really smart about how they approach those. Our health is one of our greatest gifts. If I can be helpful with that from a health coaching or a fitness perspective, my business is Ideal Health and Wellness Solutions, and that information can be found on my website, which is www.bethideal.com.
Few more minutes left. We got about a minute left.
Sure.
You kind of tucked that in there about the New Year's resolution.
Yeah.
I see everyone at the gym in January, and then I go back there in March, everyone's gone. What's a very 30-second quick tip that you can give our viewers on an easy, approachable way to do a New Year's resolution on health and wellness?
Well, think lifestyle, be smart, listen to your body. More than half of new exercisers quit in the first 3 to 6 months for a lot of different reasons. They aim too high, they get themselves injured, they try and progress too quickly. So be smart, get good information, and it's really about incremental steps. Little habits that, add up are much better than big changes that never happen.
We always overextend ourselves on our New Year's resolutions. I'm one for that too as well. And the quickest resolution is like, oh, I'm going to lose 10 pounds in 2015. But you're absolutely right. We need to make incremental changes so we're successful in what we do. So
absolutely. I
really want to thank you for coming on to the show. I know you're super busy in everything that you're doing, and it was a great conversation. Let's have you back on the show soon and talk about more health and wellness. I appreciate your time.
Sounds so good. Thanks for having me.
Thank you. Thank you for tuning in to another episode of Be Well Berkshires. I am your host, Jim Willis. Be well and be healthy. Thank you.